a look at the information we get from the Baiobit. And this was from a runner just a little bit earlier on in the year who was experiencing lots of low back pain, lots of tension with her running. And as part of our running assessment, we can use the Baiobit device. And this is a little block that sits on the back of the pelvis. And it gives us an idea about how much your pelvis is moving in the position of it during the run. And so here we can see the pelvis in all three body planes, but the main part here is this posterior tilt. So we can see that her maximum anterior position is still -3, so posterior related, and then goes all the way back to -8, whereas the side-to-side drop and the rotation is all fairly equal and okay. But this posterior tilt will mean we have a reduction in the amount of extension that she's likely to be able to achieve as we go into the push-off phase, and the pelvis will be sitting posteriorly and be creating or contributing to leading to that low back pain stiffness, and we're not having a lot of pelvic rotation going on between the left and right side as we move into extended hip position. And then just have a look down this other view. This is the transverse plane rotations. Even though it's equal, again, we're not really fitting in that normal line, so a little bit flatter than we'd expect. This is that posterior. The black area is the accepted norm. We're much below that posteriorly. And again, the drop sitting closer to that expected norm, but again, a little bit of deviation in that, maybe coming in a little bit flat, a little bit low on this side. Which shows that pelvis is just being held in that stiffer position, which gives us a good a load of information to show where we really need to be directing this treatment, which is getting this low back flexibility, this pelvic rotation, left to right rotation going on as she moves into that push-off phase. So this information just adds another level of assessment to help make sure we're addressing all the issues that may be of concern.